Hello, good evening. New shocking details of NHS staff concerns about the neglect of mental health patients in North Wales have emerged. This programme can exclusively reveal. ITV News has been leaked a copy of a report that Betsy Cadwallader Health Board tried to keep from public eyes for 6 years. Tonight, we take a closer look at that report and hear from families who say that despite the passage of time, the Health Board has yet to learn lessons. Well, we can cross live now to our health correspondent, James Crichton-Smith, who is in Bangor for us this evening. James.
Andrea, this is the report the Health Board does not want you to see. It centres on the Hergest Mental Health Unit that's here at Ysbyty Gwynedd. It focuses on staff concerns around patient safety and gives an account of one patient who sadly died while there was no doctor available, another patient who attempted to take their own life, again while there was no doctor available. Families for years have tried to get this report public, but tonight the Health Board is still refusing to do so. Those families therefore say the Health Board's been embarked on a cover-up they say of its failure to do the best for patients and staff. David's late mother, Jean, was a patient in the Hergest unit of Ysbyty Gwynedd. He's always argued that what she experienced there was neglect, not because staff didn't try to care for her, but because the service they were working in was so stretched, morale so low, and management so poor that it was impossible. A report was commissioned after staff on the same unit blew the whistle about their concerns. The details are shocking. This is the first time David has seen them.
My mum was on the unit from July 2013 to October 2013. She was not particularly a well woman when she arrived, but by the time she left, her deterioration was so unbelievably marked. Her appearance had changed so drastically because of a 23% loss in body mass. It wasn't neglect by the staff on Hergest. They knew they couldn't meet those patients' needs. It's why they were screaming for help. It's why they were whistleblowing and putting their careers on the line asking for help, because they knew they couldn't provide dignity of care. And it's such a bland dignity of care. What does that mean? It means people who are doubly incontinent having to clean themselves up whilst they're banging furniture and banging walls. And
it was just a few months after David's mother was discharged that the Robin Holden report was completed. While this summary has been made public, the full document, seen exclusively by ITV News, was based on interviews with 45 staff and 700 pages of witness statements. It details how staff were very intimidated and fearful for their jobs. Others feared for their patients. The full report states that basic physical care, such as attention to personal hygiene, is, at times, neglected. Staff testimony states the quiet ones, that's patients that are actually too ill to speak out, sometimes you sort of forget about them and maybe they haven't had a drink. Another says sometimes when people are that quiet they just get left, and I don't feel that I'm doing a good job even though I've been struggling to do everything I can. You know you've done everything you could have done, but you know that Mr. has been neglected. One adds, if everybody is still alive at the end of the day, that's the best I can do. What's significant about this report, aside from its contents, is that while it was being kept from public view by Betsy Cadwallader Health Board, just down the road in a neighbouring hospital, Ysbyty Clwyd, there was another mental health unit scandal being uncovered and allegations of institutional abuse being made. That was Talfan. There have been multiple public reports into that mental health unit, and yet this report into Hergest has not been made public. What's more, families have spoken to me and said that even as recently as 2018, they say lessons have not been learned. Debbie's daughter Sophie was a patient in Hergest 2 years ago while she experienced periods of psychosis. It was a time the Health Board says things were getting better. Do you feel that lessons are being learned?
No, not at all. Not at all.
And how does that make you feel?
It makes you feel awful because, you know, no one chooses to go through this, you know. But it just felt like we were just there, we wasn't human beings, and that we didn't deserve the care and that we just weren't worthy of it, basically.
To me, it's like they're shut away, closed away, and they're forgotten about. And I just think something's got to be done.
Do you have any faith that something will be done?
No. I dread the day, because Sophie's had 2 bouts of psychosis. Twice she's ended up there. And I always said I couldn't let her go back there.
But it's not just families that are concerned, it's staff too. One of those staff who blew the whistle all those years ago said that there is still a huge disconnect between clinical staff and management. They went on to tell me that there is a toxic bullying culture where the priority is appearances rather than an open learning culture where staff are valued and listened to. Betsy Cadwallader Health Board still doesn't want the Holden report made public and is appealing an Information Commissioner's ruling which said it was wrong to withhold it. The Health Board says to release it would breach the confidence of those members of staff who contributed to it. It also says it's taken action to get better and that inspections since 2014 have shown improved standards of care, staff morale and leadership arrangements. It says patients are generally very positive about the care they have received.
It doesn't wash, and it does make me angry, and it makes me feel for those poor people who made that testimony, all 40 of them who made those testimonies 7 years ago, to be told they didn't want their testimonies to be heard. That is an insult.
It is worth remembering that it was mental health failings that were part of the reason this health board 5 years ago was put into special measures. The health minister then, Mark Drakeford, is now the First Minister, and we asked him whether he had anything to say about this report. He said he wasn't in a position to comment. We also asked the Health Minister yesterday if he would like to do an interview with us on this, and he declined the opportunity. Instead, the Welsh Government issued a statement, and it reads, "The Health Board has already taken a number of actions in response to the report's recommendations. The board is appealing the decision to publish the report to protect staff who raised concerns and contributed to it." An unannounced healthcare inspector at Wales' inspection of the Hergus units in 2018 found that overall the unit provided safe care. As to whether the Health Board will release this report off its own back remains to be seen. Of course, we will wait for that decision on that appeal.
James, thank you.